Global Multilateral, realizing just transitions. Global Multilateral, realizing just transitions. Realizing just transitions. Welcome to the German Climate Pavilion at COP30 in Billy.
Well, good afternoon, everyone. Welcome. We are going to get started now for a really important discussion on advancing health and equity in a changing climate. say this is an immersive experience because we are all feeling the heat. And we're going to be talking about how extreme heat is both a climate challenge and a health challenge that disproportionately impacts women. And we are going to dive into kind of the many ways different organizations across sectors are working to tackle that. I would love to first introduce to the stage one of the organizers of this event, as hosted by Bayer and ICC, Helga Flores Trejo, who's the VP, Special Envoy for Multilateral Affairs and Sustainability at Bayer, and Vice Chair of the Global Environment and Energy Commission of the International Chamber of Commerce. Helga, I'd love for you to come to stage and really set the stage for us, and then I will also invite our other panelists to come join us as well.
Well, does this do the trick? Thank you, Kate, indeed, and thank you for joining us both online and here in Belém. And indeed, the topic we're going to discuss today, climate and health, there's nothing abstract about it. In fact, if you have been a couple of days here in Belém with us, you have been, as you said, feeling the heat, right? Now, question to you. Could you raise your hand if you adapted the way you dress to deal with this, right? So there's indeed nothing abstract about the topic. It is about adaptation, but what I find important to highlight about what we're going to discuss here this afternoon is that when you start talking about adaptation and health, what you really put is in front and center is the perspective of humans. When we discuss mitigation, well, carbon, we don't feel carbon when we experience climate change. We experience climate change only because we feel heat, or we are affected by droughts, or by flooding, wind, etc., etc. So this is an important, I think, change of perspective, and it is extremely real. Now, in fact, 2024, last year indeed, was the hottest year ever recorded. So it's scary. And if you look at the life, how that's had impacted our lives, all of us, everybody in the world, we have calculated that the average person experiences 16 days of extreme heat. And with that, I mean dangerous for health in average last year. That's a fourfold increase from previous years. Now, globally, there's also data that about 2.4 billion people, workers, are affected by or vulnerable to climate change. And what does that mean? Well, there's certainly health consequences when we think we are Bayer, right? Cardiovascular, that's our topic. So cardiovascular disease, kidney disease, are some of the ways humans are affected by it, but unfortunately also economically. And let me give you a couple of numbers because I thought it was staggering also that what we have seen is the loss of productivity, increase of poverty with heat. What do you have? You had last year 640 billion labor hours that were lost because people could not work with heat. And the productivity calculation of the economic value of productivity loss was about $1.9 trillion. And certainly this is something we are going to talk about here today. Well, especially how it affects vulnerable population. Women, pregnant women, children, the elderly, and outdoor workers. Now, despite these numbers that I just told you, both economic and health-wise, the truth is that the public policy response and also the public health system's preparedness is not there yet. If you will, is largely still unprepared because the topic has increased just dramatically in the past years. But today, we have an opportunity in the conversation with all of you to start looking of how we can address it. In Bayer, the company I work for, we certainly think that we can contribute with science, with innovation, and that's the way we can contribute, and with increasing access. But the stakeholders all in this panel today have a very specific perspective and contribution they can do to tackling the challenge. So with that, thank you in any case, and over to you, Kate.
Thank you, Helga. I think that set the stage really nicely. And I would like to introduce our panelists to you. We have at the end Dr. Shyam Bishen, who's the head of the Center for Health and Healthcare at the World Economic Forum. We have Jochen Renger, who's the head of Division for Climate Change, Rural Development and Infrastructure at GIZ. Florbela Fernandes, the UNFPA representative here in Brazil. And then we have joining us online, Ndidi Okonkwo, Nwuneli, President and CEO of the One Campaign. Ndidi, thank you for joining us virtually. So I want to give a disclaimer that Shyam here on the end and Jochen are going to both have to leave a little early, so do not think that they are being rude or storming off the panel, but we really appreciate them fitting in the time to have this really important conversation. So Shyam, I will start with you, and Helga talked about the many stakeholders that need to come together to tackle this challenge. From your position at WEF, you work with a lot of private sector companies, and obviously private sector companies are seen as maybe part of the challenges, but also certainly part of the solution. And then particularly when you look at the effects of extreme heat on labor and productivity, there really is incentives for private sector to get involved. And so I just, from your vantage, where do you see the role of private sector fitting into this? And maybe some examples of where you think that it's gone well.
Thank you. Thanks for having me on this panel. The topic of discussion here, advancing health equity in changing climate, is very close to our heart at the World Economic Forum. Within my center, Center for Health and Healthcare, we have two big initiatives. One is focused on health equity, which is about health for all. The other one is on climate and health. And so obviously nothing is in silo. These two initiatives are working together. For those of you who may not know about World Economic Forum much, we are a non-profit international organization that's dedicated to public-private partnership. So that's our platform. We try to use this platform, bring this platform to solve for global systemic issues. And we do believe that climate change and its impact on human health is a global challenge. It's a public health emergency. So we are working to solve some of these by engaging our private sector partners. We have about 1,000 corporate partners. These are big companies of the world, MNCs, that are our partners. We bring them together with public sector, with governments, other international organizations, civil society, philanthropy, academia, and others, to look at some of these issues that we are talking here at COP30. We know by now that climate change is already directly affecting global health, where lower and middle income population, the population that's most vulnerable, is greatly impacted. What we have done is we started this initiative, Climate and Health, about 3 years ago. First, we focused on bringing visibility, awareness to the issue. As you know, 5 years ago, even 4 or 5 years ago, everybody was talking about decarbonization, mitigation strategies, which are important, and we need to do that. We need to turn off the tap. But people thought that, the human health effect, the effect on diseases and all, that will come 10, 15, 20 years from now, not to worry right now. But I was really delighted to see during COP28 in Dubai, I think we were all there, we launched the first health day. And since then, we have been making slowly but surely some progress in this area, where, as I said earlier, we are bringing private sector. In fact, when we started out in this initiative, we started out with companies like our partners like Bayer, Sanofi, AstraZeneca, Kaiser Permanente, and a few others, mainly in the life sciences, healthcare arena. But now the other sectors like insurance, construction, food and egg, and many other sectors have joined us. So we truly believe that it's a cross-sectoral issue, and we need to have a cross-sectoral approach to solve for this. We started out in doing, as I said, bringing some visibility to the issue, doing some research. We worked with our partner, Oliver Wyman, to look at the economic impact of climate change on human health, to look at the human toll. And we published a report 2 years ago that talks about, under the current trajectory, if we don't do anything, an additional 14.5 million people will die by 2050. So that's a huge number. That's in addition to all the other dates we talk about. We also look at, our name is World Economic Forum. We always looking at the economic impact of projects and things that we are working on. We looked at the economic impact of climate change on human health. Again, it comes up with a very large number, about $12.5 trillion by 2050. So then what do we do about this? We have the research, we have the research-based analysis, some evidence. Now we have started to focus on some place-based change approaches where we are working at the national and subnational level, bringing, for example, the Ministry of Health, Ministry of Environment, Ministry of Finance, together with the healthcare companies and other sector corporations to look at what we can do in particular localities. For example, the impact of extreme heat, what we are facing here on workers. I think according to another analysis that we have recently published, if we just look at the three sectors, healthcare, construction, and food and ag, the impact of climate change on workers, on community, just in three sectors is about $1.5 trillion. When we talk about these numbers, we talk to our partners, private sector, they see the bottom line impact. They see the impact of some of these extreme weather events on their employees, on their communities, on their customers, and on their bottom line. And so they get interested in talking to us, in working with us. Another area, so we are working in that area, looking at the impact of extreme weather events on workers, on communities, in place-based approach. And the second area that we are focused on is more looking on the financing of climate change and its impact on human health. Obviously, all of this work that we are talking here requires funding, requires budget. Most of the public sector budget is under tremendous stress right now. Public sector budget, governments have to focus their money somewhere else to pay for tariffs, to pay for armies, to pay for military. Some of that is escalating, some of the conflicts are escalating. So we feel like private sector, private capital can be activated here. So we have started to work with our corporate partners, especially partners in the financing sector, to show them that it's not just philanthropy, it's not just a social impact, but there are ideas here that can generate a desirable rate of return for you. And so that's the work that we have started to do. And would love to talk more about this, but we can point you to some of the reports that we have done, and hopefully we can continue this conversation. I know our time is limited here, and apologies for running off, but thank you for having me here.
Yeah, thank you. And I think that has been a recurring theme in a lot of the conversations this week, is how you make both the economic case alongside the moral case. And so, Jochen, I'd like to bring you in, and even talking about capital and finance. And, there's been a big push to have more integrated healthcare, particularly in combating NCDs, and that can be a more efficient way of delivering healthcare. Can you talk a little bit about how GIZ is approaching that, maybe even give some examples of how you're integrating the climate impacts into a broader One Health strategy?
Yeah, thank you very much for having me here on stage. Accept my apologies for my voice, it's quite down. I know it sounds like Alice Cooper after a 3-hour heavy metal concert, but maybe this is part of my communication strategy, I don't know exactly. So again, thank you very much to having GIZ here. it's extremely important that we have climate and health now on stage and in the COP. Because let me start simply saying what we see in GIZ is that the climate change is, yes, it's an environmental crisis, it's also an economic crisis, but it's a health crisis and it's also an equity crisis. And I think this brings us here now together. The impacts of heat, of water scarcity and floodings and so on and so forth are not gender neutral. That's very obvious, and I'd like to, flag this from the very beginning. Women, especially, mothers and caregivers, often face the greatest risks here while having the least access to sound healthcare facilities. And other vulnerable groups are also subject to, health risks such as indigenous people and also all kind of low income groups. So that's why GIZ is really convinced that strengthening, let's say, gender responsive and inclusive health approaches is essential to adaptation. It's part of adaptation to climate change. And when we talk about the nexus, and I would really like to call it a nexus of climate change and health, particularly around the non-communicable diseases, we are really addressing a kind of systemic vulnerability. And the question is, or it's actually all about, how existing health inequities are magnified by climate change. So it's getting worse and worse, so to speak. For GIZ, integrated care models are key in this regard because these are most effective ways, to be honest, because they combine prevention, treatment, and resilience under one approach. And we've seen this work in practice in many places all over the world. For instance, in African countries such as Malawi, Benin, and elsewhere where we support, climate-informed primary care systems that integrate really disease prevention with a broader adaptation strategy also. And especially in these regions there, health facilities under heavy pressure by extreme weather events, for instance, by flood, the lack of resources. And, all this, is a real challenge for the communities, and all these disasters, they of course lead to severe outbreaks of diseases. All this shows how urgent it is really to address climate resilient health systems. And one can see also kind of, we can catch, two birds with one stone, so to speak. For instance, when we establish solar-powered energy systems at hospitals, these clinics are clearly, more resilient to climate change risks. And clinics like this, they simply make sure that, operations can go on. Just to close here my intervention, GIZ's approach focus on four major areas, four priority areas. The first is advocating the nexus of climate change and health. That's why we are here now. We have to ring the bell. We have to make a lot of wake-up calls. Let's face it. And I'm proud to be part of this exercise now. A second priority for us is really to promote cross-sectoral collaboration. It has been mentioned by my colleague already. We cannot operate in silos, makes no sense at all. So there is a clear, interconnection between health and environment and agriculture and water and even energy. And we have to, we have to unfold, we still have to unfold the potential of cross-sectoral collaboration here. A third focal area for us is, scaling up evidence-based solutions. I mean, everybody is talking about scaling up here at the COP. It seems to be a kind of final challenge, so to speak. It's not easy. But, using evidence-based approaches and proven approaches, this simply saves a lot of time, it saves a lot of costs, and it's much more effective and efficient. So let's go for the scaling up approach. Last point, we are also working on integrated financial mechanisms for, the nexus of climate change and health. And I'm very happy that the Green Climate Fund has now also picked up the nexus of climate change and health. And this is really a very, very good sign. So at this moment, so far, so good. Over to you. Thank you.
Great, thank you. And so, Florbela, to bring you in, we're talking about how a lot of the health impacts of climate change disproportionately affect vulnerable groups, often exacerbating existing inequalities, and particularly look at women and pregnant women, which not only impacts their health, but potentially the health of their baby and future child development. So how do you, from your vantage point at UNFPA, see health systems needing to evolve to incorporate a more gender-responsive climate adaptation?
Thank you. Thank you so much. Let me start by thanking for this opportunity to join the panel. And indeed, UNFPA, so the United Nations Population Fund, is an agency that is concerned with sexual and reproductive health. Now, you brought one important thing, which is to think about pregnant mothers, and through them, that the climate change that we're talking about today here in Belém is actually going to affect generations to come. So it's not just us. We have to think that it is pregnant women that we need to protect because they are carrying the babies, right? And so this health exposure and the climate hazard puts their lives in danger, but potentially puts the lives of the babies in danger too. So one important point that my colleagues here from the panel have already mentioned is the investment needed for data, evidence, research. And for that data to be collected with the people that are most vulnerable, right? So they need to be part also of the data collection, data interpretation, and data use. And with that, we'll be able to identify who are those that are most affected, who are those that are experiencing vulnerabilities, where do they live? Do they also live in conditions that they expose them to further dangers, further situations that leave them behind? So that's a very important point. And of course, being able to socialize the data as well. So it's of no use if UNFPA is producing its own data, GSI too, and so on and so forth. So let's make sure that the data is available, that the data is disaggregated, and that the data is made of use. And when we talk about making data of use, we of course now want to, and I want to move to my second point, which is how do we influence the normative, the policy, so that this change can actually happen? So one important thing that we note as the Sexual Reproductive Health Agency is that now that we have all the evidence, time has come to ensure that the national plans do have women, pregnant women, do consider sexual reproductive health, do consider that adolescents and young people need information, but that they can also lead the processes. So having that in the national plans is important, and also committing budget. Because if it's of no use if you plan well, but you do not allocate resources. And I'm mentioning these two important points because we did have a great opportunity in Brazil to hold a global symposium on climate change. And what we realize is climate justice is important. So I'm also calling our audience here to actually get acquainted with the Belém Plan of Action, which really goes very specifically about what is it that governments can do to improve on this agenda. My last point concerns the need for integration, which was also mentioned here. So if it's no use if it's just health systems that are adapting, but the other sectors are not adapting. And which other sectors am I mentioning? For example, if you think about the work environment and pregnant women or women that are breastfeeding, to have policies that allow them to exercise remote work, for example, right? Then if you talk about social protection too, to ensure that there is social protection as a mitigation measure for those women and girls that are left behind and do need additional support too. Thank you.
Thank you. So let's see, is this on? Oh, there we go. So Ndidi, I want to bring you in. We're going to bring it here in. Oh, great, we have you on the screen. So thank you for joining us remotely. And Jochen brought up a point about we got to ring the bell. And then Florbela talked about the power of data. And you often talk about the power of storytelling and be able to drive systems change. And one campaign is a enormous advocacy group that is really telling these stories, that really centering the lived experience of people. And so I'd love to hear kind of your thoughts on the role of storytelling and particularly centering lived experience and be able to drive some of this change we know we need to see.
You can hear me in the room. I'm really
Yes, we
sorry
hear you
I'm
great.
not there in person. I've been seeing the great photos and stories from Berlin. So there is some storytelling coming out of this experience. And for those who don't know One Campaign, we're a global advocacy organization that fights for the investments to ensure healthier lives and economic opportunity in Africa. And climate is cross-cutting. You can't have healthier lives and economic opportunity without addressing the climate challenge. And as has been shared, storytelling is key to what we do, not only to raise awareness, but to galvanize support at all levels. Clearly, we want to shape policy ultimately, and that's what you're doing in Belém. But if you don't have citizen action, you don't have community mobilization, you don't have influencers like faith leaders and celebrity voices lending their platforms to a cause, oftentimes it becomes, short-lived. And I've been thinking, we get so excited leading up to the COP, and then right after the COP, the stories die and people move on to the next conference. And already people are saying, okay, what are we doing in January, Davos, and February, this, and March? And that's the tragedy of our sector and of our work. And so for me, it's a real commitment to multi-year, all-year storytelling, putting out, number one, the hypocrisy that continues to exist. And actually, the One Campaign put out a great report on the climate finance hypocrisy and the climate finance files, which followed the money and all the commitments that come out of COPs, right? Not just from the private sector, but from the public sector and civil society, seeing how much is actually fulfilled. And we know that so little is fulfilled. And on our One Data platform, I encourage you to follow the money, because the money shows you where people's hearts are and where their minds are and where the difference is between smoking mirrors and commitments and action. So I would say three things in terms of storytelling and changing narratives. The first is it has to be grounded in the realities of who we're designing for. And ultimately, it's the most vulnerable that we must continue to design for. The voiceless and often those who are not in the room, and telling their stories and the health and climate impacts. And I think our first speaker started off telling us some of the data, but it goes beyond the data to the human stories and the toll. And oftentimes I think our societies and our governments don't recognize the lost GDP per capita linked to climate-related health diseases, right? The productivity losses in the private sector linked to climate health-related diseases. And I could go on and on, but telling those human stories and linking them to impact on the bottom line is key, and it has to be sustained all year round. So we need those stories, we need that data, and we need to merge them. The second is who is telling the story and how authentic is their voice and what method are they utilizing. And at One, we're learning more than ever before that unfortunately people are not going to traditional media to get stories, right? And they're not really believing the big names anymore. They're believing the community individual who resonates with them. And that's why we've invested so much in faith leaders and faith leaders who come from trusted circles in communities and leveraging their voices to speak up, but also the youth voices, which is paramount to this work, and getting them early enough, but also their sustained interest and engagement with the data and with the right messaging. So how do we sustain it? And through the right channels. We have to use non-traditional channels, social media in ways that we haven't leveraged before, and not ending up our reports in just big drawers that never get read. So TikTok and Snapchat and all of those tools are critical. And then the final thing I'll say, it's really important that we, in terms of breaking these silos, that we really take an ecosystem approach. Because when we think about the work that we continue to do, unfortunately, even in the messaging, even in the storytelling, it's so singular. And the single issues don't get us very far. And so how we link it up to every single moment of the year, and I'm just going to throw out an idea. For example, we know we have the World Cup coming up. That is an opportunity globally to leverage moments where people do get concerned about the issues, right? And I'm talking about beyond the traditional approaches. How can we keep this momentum going? And what moments in 2026 and beyond can we leverage to really amplify this work? At one, we're very, very concerned about the siloed approach and the continued siloed approach and how we continue to segment the work, but how also we continue to fight for the money between the sectors and fight for the resources between the sectors, and unfortunately replicate the same mechanisms across the sectors. And I think there's an urgent need for sustained impact around ecosystem building and ecosystem solutions, especially at a time when there's limited funding for development action and more needs and more pronounced needs, but also the technology and innovation to solve the problems of our time right now. So we're so close to solving some of these problems. We need to work together and reduce the inefficiencies in the system. I've said no more compacts, no more panels, no more contracts, no more. We just need no more conferences. We actually need to just have action on the ground. Thank you.
Thank you, Ndidi. And yeah, I know it often feels like we're all just preaching to the choir here. And I was actually convening the other night with several young TikTok and YouTube influencers, and it's great to see them here and be able to bring some of these stories to their audiences that hopefully will carry these messages beyond these conference walls. And I think often a challenge too with the storytelling is many organizations are incentivized to tell stories of despair, and that can lead to inaction, and really being able to share stories of work that is happening and progress and success stories can really help bring more people in and feeling like they can contribute to this cause. And so, Helga, with that, I would love to hear some maybe examples of what you're seeing doing well when it takes to multi-sectoral approaches and bringing different partners together to solve these issues.
I think what's important, and it was mentioned before, given that this nexus is still rather new for many actors, companies like us as a pharmaceutical, a company that can contribute, I think what we have to do is really go beyond the comfort zone and reach out to others to do very concrete things. And what's interesting for us is that our mission is health for all and hunger for none. So if you will, it really connects nutrition, women's health, cardiovascular, so many parts of, I think, of what we are seeing here. So let me give you a couple of examples because it's rather just happened actually a couple of hours ago. Florbela was talking about the data. So we just announced a partnership with UNFPA exactly on that. And what's interesting is that it has two focus: to do forecasting analysis at the country level with innovative tools and get that data insights over to the public policy to strengthen the health systems. And why is the focus, by the way, it's going to be Brazil, Mexico, and Central America. So a couple of interesting countries, so there's action there. Now, why is it interesting is that it's the first time we're going to do at country level this risk analysis of climate and health and be able to provide that data for governments. And if you will, just imagine, for me it was very interesting because you don't see. It's very difficult, I think, for people to understand the danger they're on and also for public policy to educate. So I was very intrigued when already a couple of years ago in Washington, the Atlantic Council actually started suggesting that we needed to actually name heat waves the way you name hurricanes. We're very aware in Florida, certainly, for those who are Americans, there's a name for a hurricane, people know, and then they will know what to do. With heat, a lot of the populations do not know, A, that it's so dangerous, and don't know what to do. So those are some ideas, but this partnership that we just launched, just coming back to UNFPA, is exactly both coming out of the comfort zone, looking to tackle the problem where it needs to be, data, for example. And for us, it is highly relevant because A, is the first at country level, as I was saying. Second is we are the first company joining this effort of the data that UNFPA is doing. And third, and also importantly, is that it's focusing on women. And I believe that, again, it's making sure that we know exactly the target population and focusing is the way you're going to succeed. We have other examples, but let me stop there as a showcasing just something that I think we can do.
Thank you. And I did want to see if there's anyone in the audience that has a question. We are happy to take those and address, but fine if not, we can get you on. But raise your hand if you would like to jump. Okay, go ahead. Here.
Thank you. My name is Colin O'Haggerty. I'm a senior undergraduate at UNC Chapel Hill's School of Public Health. I guess I'm curious, you talk about the Bayer and UNFPA public-private partnership. I'm curious if there are any examples or ways that you all can see the private sector getting involved in these types of partnerships for the implementation of solutions to the heat problem as opposed to research or analysis. Both are extremely vital, and we've talked a lot about the data that exists today. Are there any examples you can think of how you can leverage that data with private sector resources to start solving the problems that we're seeing?
Anyone want to take that one? Logan? I think it's on.
Thank you. Well, just go a little bit back and say, what we were able to launch together was also the result of the study done in Cuba and El Salvador. So already we have a good result there, and what we are proposing is to work together on the same type of research for Brazil and Mexico next year. Of course, as you talk about research, you're actually bringing recommendations, findings, and our role as UNFPA is also then to engage in policy dialogue, with the entities that can then turn those findings and recommendations into solutions. Now, of course, we do that with governments, but we also do so with private sector, with civil society, and etc. I'm mentioning Bayer that we signed, and another important point of this partnership is that we actually engage in mapping, not only where health systems can be strengthened, but also a combination which looks at where vulnerable people live and what type of vulnerabilities exist. So it's a good mapping, really, to look at the prevention. And increasingly, we want to look also at foresight. What is it that beyond the immediate here and now, we can already predict for the future and therefore be able to anticipate. Now, another example that we have is with the Teresina municipality. There too, municipality conducted a study really looking at the heat and pregnancy. And now what we see, because you're asking, how about implementation? If you read the study, which we'll be able to share with you, you actually see very simple actions that municipality structures can implement, but so can community members. For example, what they have decided to do is that every time a baby is born, and therefore the family leaves the hospital with the child, they also leave with a seed or with a plant. and they will be planting. And with that, contributing again to reforestation, which is something important. And apart from that, of course, training health members so that they can provide information about heat and consequences for pregnant women. And it doesn't stop there. With innovation, once the study is out, which was the case, and they actually received a global prize for this initiative, they are also now engaged in South-South cooperation, for example. A municipality in Mozambique, one of the African countries, is interested in the type of work that they do. So they are actually, I think it's going to be this week, traveling there to actually wanting to know how they went through the process and what measures they are implementing. So considering also knowledge exchange is very important because it's powerful. You know, if it has happened in one place, you can always adapt and use it to, you know, ensure that other changes can be brought to. Thank you.
Thank you. And I love that it's not just the North-South collaboration, but South-South collaboration that's really important. I want to, I know we have limited time left, but just ask each of you kind of, you know, health is newer to the agenda here at COP. You know, and often I see that they are very siloed conversations. People work in health and people work in climate and often speak different languages. And, you know, you have a health minister, an environment minister, and there's a lot of challenges of just the collaboration, but it's been great to see some momentum in the past few years accompanying these COPs of health really being on the agenda and more of these worlds coming together and collaborating. I'd just like to ask each of you kind of what you would like to see, whether it's a mindset shift or policy shifts or you know, other kinds of partnerships to really be able to, say in a few years' time when we gather at a future COP, that we've really made progress on this issue. You know, if there's one thing that you could wish for, what might be? And Jochen, I'll start with you.
Well, that's a nice question, actually, yeah, because it forces us to think, to really think about the future. And you know, well, it's a good question. As we leave here the COP30, and I really hope that in 5 years' time we can really look back and see real progress in, you know, breaking up the sector silos, and also in, you know, most important, to ensuring women's health and climate resilience, that they are no longer treated as a kind of separate agenda thing, yeah, that it's really part of policies, part of the discussions, and so on and so forth. And I'm always optimistic, although I am a German, yeah.
Very off-brand.
So I can really see progress. I mean, this is the 5th COP that I am experiencing now, and it's getting really better. It's not fast enough. Yeah, but that's life. But it's, you know, moving. A second thing is I would like to see integrated climate policies that really integrate gender equality and health at every level, at the national level, at the regional level, and also on the local level, for sure. And last but not least, I'd like to see a much stronger interconnection of all these issues in national policies, and that should lead, in my opinion, to, you know, a more intensive and more meaningful participation and inclusion of women in decision-making processes. Also still a long way to go, but I mean, this panel is a perfect example. I'm happy to add now some gender balance to this panel, you see. So this is a first serious step now, and I'm grateful for that. Thank you very much.
Yeah, so we know when we solve for the most vulnerable, we solve for everyone. So thank you. Florbela?
Well, for me, 2 important points. One is that, as we know, Brazil is calling this COP the COP of action. And so really from now onwards, let's ensure that action, action, and action, and action is the way forward. No longer like, the previous panelists mentioned, meetings and meetings and meetings and meetings. Let's translate the commitments into actions. Let's actually transform the lives. Let's improve now so that we can, save the planet, but most importantly, save the human beings that live in the planet too. I think that's important. The second, the last point, is the need to put women and girls at the center of the climate agenda. So indeed, we cannot continue to be having a COP where there's no gender action plan, no commitment to gender, simply ignoring that. We know already that even as we look at the Sustainable Development Goals, one of the goals that we are far behind is indeed our commitment to gender equality. So we need to accelerate the path. Commitments to gender should be in the plan, budgets allocated to it too. And as I mentioned, and this is the last point, let's look also at left behind populations. Because usually what we see as we engage in this agenda of climate is that they are the least that contributed to the scenario that we are having now, but they are the most affected. So we also need to put them first as we go forward. Thank you.
Thank you. And I don't know if we lost Ndidi here. We may have lost her. So Helga, I will move to you.
For that, I hope. Is it okay now? For that, okay. Is it okay now? Okay. Maybe also two things. Because you ask about, well, the science, but science is extremely important. And the challenge is that we are even seeing, to take the example of Central America, growing diseases, kidney disease, chronic kidney disease among young population, working on the fields. Sometimes it's a bit unknown, so we're putting efforts on understanding exactly how heat is affecting us, and so that's essential for us to then really tackle it. So understanding that the science and the research on that to raise the awareness is key. But the second, and probably my biggest wish, health is always seen as a cost. It's always seen as a burden, and very often not as high as in the political priority as it needs to be. The numbers I gave you of the productivity loss, of the loss of hours that people could have worked and contributed to the economy, shows you exactly why we need to see health as an investment, and therefore much higher in the agenda. And in a way, I think we've all have talked about that. The shared experience of heat here in Belém, the immersive experience that we all had here the past days, hopefully would help when people go back to their capitals or places. They'll remember, and they'll if they put you in your shoes, how would you feel if you're pregnant added to that under this heat? If you don't have enough water, if you cannot have an air conditioner or ventilators, as we here, thanks to the German pavilion, we do have. So going back, putting themselves in the shoes of the others, of how does it feel, heat, and understanding health as an investment.
Yes, for all the complaints, I actually think it maybe is a good thing for the negotiators to be feeling this while they are talking about these issues. And Ndidi, I'd love to hear from you.
Hear me before. So I completely agree with all the panelists, and it's been a pleasure hearing such brilliant insights. I'll add three more things, building on what you had said, Kate. I would love to see a lot more innovations that are cross-cutting, that have scaled, that we can come and celebrate. I think oftentimes in many of our climate health, food nexus initiatives, they're still very much at the pilot, and the funding and the support to scale them and come back to celebrate would be key. The second is I would love to see, instead of having this health and ag and food days, well, it was really good when we're just introducing them gradually, to come to a point where we don't need to have them, because in every country pavilion would be the cross-cutting agenda that would fully integrate all of those issues. For me, that's key. And number three, as we think about one and some of the North Star agenda items we've laid out, that by 2035, all African countries or majority will be fully self-sufficient financing their own health, and that, would have halved under 5 mortality. I think those type of goals that are cross-cutting, like under 5, like maternal mortality that have been raised, that have both a climate solution, a food and ag solution, a health solution that can work in tandem, have to be numbers we actually track and hold ourselves accountable for, because ultimately that is really key. And then the final thing I would say, I love all the shout outs on gender and women. I also think it's really, really important. We've talked about it at length, but it's really about the youth. On the continent, majority of our population is under 19. And we should be defining that future with them really then being the ones leading the conversations in many of our contexts. And I look forward to celebrating their successes, their stories, and the innovations we can drive home together. Thank you.
Yes, thank you. Yes, thank you. And even from our reporting and coverage at Devex, we always talk, is climate a vertical or a horizontal? And it's kind of both, but really it's the cross-cutting issue of our time. So no matter what perspective you're working from, you have to have a climate lens. Well, thank you all, and thank you to the panelists. Thank you to the German Pavilion and the Bayer and ICC for convening this conversation. For those of you also joined in person and online, really fascinating, and hopefully just the start of many more conversations to come. Any other final thoughts, Helga?
Thanks, Kate. Thank you. And now I think water, drink water.
And drink lots of water. All right. Well, thank you, and thank you, Ndidi, for joining us online.
Bye.
Bye.
Global Multilateral, realizing just transitions. Welcome to the German Climate Pavilion at COP30 in Bishen.